Good afternoon, class.
Good afternoon, madam.
Okay, welcome to our lesson today. Let me start from calling the register. Tabitha,
Present.
Milka.
Present, madam.
Okay, our topic today is on HIV and AIDS. We have got HIV and AIDS, and someone can define for me what is HIV. Milka.
Trial. It is a human immunodeficiency virus, while AIDS means acquired immunodeficiency syndrome.
Okay, thank you. HIV means human immune deficiency virus, while AIDS means acquired immunodeficiency syndrome. Okay, let's move on how HIV can be spread. The first point we have that HIV can be spread by having sex with infected partners.
Point of correction, Mwalimu.
Yes.
By having sex with infected partner without condom.
Okay, thank you for that. We have by sharing sharp contaminated syringe, like the needle and the razor blade. Also, we have from infected blood transfusion, through breastfeeding a child with infected mothers. Let's move on the infectious common to HIV and AIDS. Tabitha, can you list them?
We have a cardiasis thrush,
Yes.
tuberculosis, cytomegalovirus, cytocosis meningitis, toxoplasmosis.
Okay, we also have the pneumosis pneumonia. Let's move at the prevention of HIV. Who can give a trial how HIV can be prevented? Any trial? Catherine? Milka?
You can choose less risk behavior, where is HIV spread by having anal or vaginal sex without a condom or without taking medicines to prevent or treat HIV.
Okay, thank you. We also have get tested for HIV. You have to talk to your partner about HIV testing and getting testing before you have sex. We have limit your number of sexual partners. The more partners you have, the more likely you are to have a partner with poorly controlled HIV, to have a partner with sexually transmitted disease. This means that if you have more than one partner, there is the risk of highly getting HIV and AIDS. Let's move to the symptoms of HIV and AIDS. Tabitha, kindly give a trial.
We have a weight loss,
Yes.
diarrhea.
Yes.
Yeah.
Okay, thank you. We also have the muscle ache and joint pain. We have the sore throat and painful mouth sores. We have swollen lip glands, and it mainly on the neck. Yes, we have diarrhea and weight loss. The next point, let's move on the main first symptoms of HIV. but most people infected with HIV experiences a short flu-like illness that occurs 2 to 6 weeks after injection. It's estimated up to 80% of people who are infected with HIV experience this flu-like illness. The most common symptoms are raised temperature, sore throat, and body thrush. We have stages of HIV and AIDS. Who can try and tell us the stages of HIV and AIDS?
Okay, there is acute HIV infection, chronic HIV infection, and the final one is AIDS.
Okay, let me elaborate more on acute HIV infection. This is the earliest stage of HIV infection, and it's generally developed within 2 to 4 weeks after injection with HIV. During this time, some people have flu-like symptoms such as fever, headache, and rash. About chronic HIV infection, we say this is the second stage of HIV infection. Is a chronic HIV infection that during this stage, HIV continues to matter in the body, but at a very slow level. People with chronic HIV infection may not have any HIV-related symptoms. Then we have the last one, it's AIDS. Is the final, the most severe stage of HIV infection. Because HIV has severely damaged the immune system, the body cannot fight off the opportunistic diseases, infections. The opportunistic ones, these are the like tuberculosis, yeah, and many others. Let's move on the components of home-based care. Catherine, are you there?
Yes,
Yes, give a try.
nursing care,
Yes. Tabitha?
hygiene,
Yeah, we have spiritual support whereby we can pray for them or tell them about the word of God.
Okay, thank you. We also have treatment of opportunistic infection. These like the tuberculosis that when it's on early stage, it can be treated. We have the nursing care, monitoring for early side effects. We have the medication that when you are being tested and you have HIV, you can get your medication and continue with your health. We have nutritional care. This means that you have to take your balanced diet. We have hygiene, exercise, emotional support, and spiritual support, whereby we have had Tabitha saying that the spiritual support is from through prayers. Yes. We have impact of HIV and AIDS on society. These are the psychological stress, an ill caregiver, reduced parenting capacity, a shift in family structure, financial deprivation, stigma and discrimination. Who can elaborate on stigma and discrimination? Tabitha?
I'm not sure about it, Mwalimu. I revert to Catherine.
Okay, let me say that stigma and discrimination is whereby those people are close to you, then they are not more close again due to this impact because of the sufferings. Okay, let's move on the relationship between drug abuse and HIV and AIDS. Milka, can you read for us? Okay, let's continue. We have relationship between drug abuse and HIV and AIDS. Drug abuse hasten the progression of HIV and its consequences, especially in the brain. Research indicates that drug addiction may increase viral load, accelerate disease progression, and worsen AIDS-related mortality, even among patients who follow the ART regime. This is the antiretroviral treatments. Okay, thank you for that. Who has any question?
I have a question.
Yes.
Uh,
No, those are the myths or a misconception. You cannot get HIV through sharing of utensils. If there is no any question, let's end from there. Let's meet on our next lesson. Thank you.